In my professional practice as a nurse, there are many challenges experienced when approaching a physician. After taking this course, I can describe my weaknesses and rationale behind this behavior. Reflecting on my learning from this class, I believe that factors like cross-cultural communication and my personality type are main reasons for feeling uncomfortable in these situations. My personality style is extroverted thinking with introverted intuition according to the personality test that I performed in Module 1 in this course. I do believe most in what I experience through my senses than focusing attention to impressions or the meaning and patterns of the information I get. I am a hands-on person, practical and learn best from visual demonstrations and experience. Person's personality affects directly to the conflict handling in different situations as per Whitworth. I like to provide care by keeping in mind other people's values and beliefs and plan best possible care for them rather than putting my biases and values first. This also sometimes causes conflict due to differences in opinions with physicians due to patients' autonomy. But on the other hand, I struggle to approach to physicians due to power differences. Power differential is significant barrier in effective communication as said by Srivastava. Due to lack of communication and part of high power distance, society where people with high designation or title are believed to have more power than individuals with lower professional title than them. After finishing this course and identifying my weaknesses, my confidence level is increased and I feel more comfortable while communicating with physicians and consider them as a member of healthcare team without considering their power. As nurses, we spend more time with patients than other healthcare professionals and we are with them during times of crisis and distress. So it is up to us to make essential decisions. It is not easy to advocate, however, it is critical in providing safe and competent nursing care.
In my clinical practice, I struggle most when having to advocate for a patient to their physician. Upon reflection, my personality type is introverted and my preferred learning style is by reflecting. When I assessed my leadership style, the results of a questionnaire indicated that I tended to be more of a task-motivated leader as opposed to a relationship-motivated leader. In addition, I can identify that my weakness in communicating with other interprofessional colleagues is because of my fear of being misunderstood and fear of interprofessional conflict. Knowing that being introverted, having a reflective learning style, and being more of a task-oriented leader, I can focus my area for improvement and growth by finding tools that help me overcome these potential barriers for optimal advocacy. The CNO indicates that a nurse demonstrates the standard of leadership by ensuring essential advocacy for their patients, place of employment, and the nursing profession. In addition, researchers explain that adopting the position of being a patient advocate is a way to increase the power and the professional status of nursing without damaging long-established images of the caring nursing profession. Identifying and reflecting on my area requiring the most growth enables me to research various methods to improve advocacy and become a more effective leader. Nurses often agree with the perception of the public that the doctor is the only authority and person who makes the decisions, or they may see themselves as powerless and without authority. Advocacy promotes the patient's right to autonomy, and it is essential in providing care with dignity and respect. In future, I can use strategies to overcome barriers to effective advocacy, including being self-aware of personal constraints to advocacy such as my leadership style, learning style, and personality type. In this course, I have learned strategies to overcome barriers to provide optimal advocacy for my patients and in turn become a better leader. I can practice being more extroverted, be more of an activist, and be more of a relationship-oriented leader to assist overcoming barriers to improve my advocacy skills. From personal experience, I understand that the more I practice something, the easier it becomes to do and the better I get at it. Researchers in a recent study state that to become better advocates, nurses need to first identify personal obstacles that hinder them from speaking up and then, using this information to develop and implement a personal action plan of new behaviors to use in patient care situations when speaking up is necessary. A strategy to help me improve advocating includes practicing advocacy with my peers and with my clinical instructor before contacting the physician. I can collaborate more with physicians when I see them on the unit and during rounds. Using practice with collaboration can help me develop more comfort and courage to speak with physicians, which promotes improved advocacy. I reduce the vulnerability of my patients by using these strategies to be a better advocate for my patients and a more effective leader. In order to advocate effectively, I can practice my communication skills and ask for constructive feedback from my colleagues. Understanding my fear of speaking to persons in higher power positions will help me focus on communication skills and lead me to improve my advocacy by being more assertive. I realize that in order to become a better advocate, I must develop professional strategies to enhance my advocacy skill to overcome personal obstacles that hinder optimal advocacy.
Advocating for patients has been the difficult part for me this clinical. My personality type is introvert and my learning style is active experimentation. That is, I learn by actively participating and doing hands-on work in order to understand and learn it better. My leadership style is participative and I value the input of team members and peers, but the responsibility of making the final decision is mine. Participative leadership lifts employee morale because employees make contributions to the decision-making process. Nursing advocacy is a very important part of the nursing practice and is a relatively modern idea. Nurses have reported frustration and anger when they have to advocate for their patient. Advocating for patients is subject to contraindications and can cause interpersonal conflicts. By acting as advocates, nurses are able to empower weak and vulnerable patients, releasing them from discomfort and unnecessary treatment. Patients also require protection from acts of incompetence by healthcare professionals. My personal weakness upon reflection was to advocate for the client, to the physician and the people with higher authority. Vulnerable patients like those with cognitive impairment or those under sedation require an advocate. I realized that I feel timid when it comes to communicating with the doctors on behalf of my client. I feel that I don't have confidence to say even the right thing to the doctor because of the fear of their position power. Advocacy in nursing is like participating with the patient in determining the meaning of health, illness, suffering and dying, providing information and supporting patients in their decisions and pleading the cause of the patient. Therefore, I believe that in order to protect my patient from wrong and unnecessary worry and support them when they're not able to speak for themselves, I should stand up for them. My role as a nurse is to support the patient in their choice. The nurse-patient relationship is very important and I believe nurses are in the best position to advocate for the client because they occupy the middle ground between the patient and the doctors. I believe the most important skill in order to advocate for your client is communication. Therefore, in order to be a good advocate, I reflected that I need to improve my communication skills. I need to communicate with the doctors more effectively so that I become more extrovert and include sensitivity as well as respect while advocating for my client.
In my practice, I've been hesitant to advocate for my clients when it involves addressing someone in another profession or addressing issues upward. I believe this tenderness stems from a lack of confidence in my own nursing assessment and communication skills. I can think of situations in the past where I've had the support of the nursing team to make a change to the client's care plan, but still I felt unsure when addressing the change with an allied health professional. At the time, I believed that I lacked an understanding of their role, or that I may be challenging their decisions without having the requisite knowledge and understanding. In addition, I don't know if I had the specialized terminology to effectively communicate my concerns for the client. Whether the issues that I believe I must know it all before addressing them, or the issues that I lack confidence in what I do know, I expect that exercising my skills and strengths will best allow me to grow into a better advocate for my clients. This puts me in the preparation stage of change, according to Prochaska and de Clement's change theory. I am creating a plan that I expect to enact in the near future. My attributes include extroversion and intuition from the Briggs-Meyer type indicator, being a task-oriented leader through Feidler's least preferred coworker scale, and I have a moderate level of communication apprehension as confirmed by the personal report of communication apprehension assessment. These are the strengths and weaknesses that I will address to improve my confidence in advocating for clients. It is interesting how the personal test both confirmed what I know about myself and illuminated more subtle aspects of those qualities. By gaining better insight into my leadership style, personality type, and communication style during this course, I will be able to identify how my strengths can be used in professional situations and what weaknesses I can improve. Through that understanding, I will be better equipped and more confident to advocate for my clients' needs.
As a new graduate, I have faced many challenges in advocating my client during my clinical practice. It is important for nurses to advocate in order to provide a safe and competent nursing care. This course helps me to better analyze my weaknesses and obligations in terms of advocacy. I have observed that my personality style has introvert characteristics and I'm more of an active learner. I'm good at remembering and understanding information by deliberating and applying the knowledge. According to the leadership style test, I am a transformational leader. Being a transformational leader, I believe in teamwork and I equally take all team members towards the goals and encourage their contribution. In terms of advocacy, I believe that powerlessness and limited communication are the barriers to approach to physician. Powerlessness is the key barrier to advocacy, where physicians are considered to have more power than nurses. Also, due to English as a second language, I always feel the hesitancy while advocating with a physician. Throughout this course, I have noticed the improvement in me. I have become more confident and have acknowledged that if I have relevant reason and enough knowledge, I shouldn't hesitate with physician. According to Alice and Hartley, the nurse should primarily emphasize on the client while assessing the need of advocacy. As nurses, it is up to us to make essential decisions as we are the healthcare professionals who spend most time with patients.